Into more stories, President Bola Tinubu said his administration will prioritize and improve Nigeria's health sector through massive investment and an increased allocation of funds to the sector in the proposed 2024 budget. He therefore appealed to Nigerian health workers practicing abroad to sacrifice their time to come back home and serve their people. Now, this was as he implored countries poaching Nigerian health workers to consider the interests of Nigeria. Tinubu made the call on Tuesday at the unveiling of the country's health sector renewal investment initiative at the State House, Abuja. Describing health as a fundamental human right, Tinubu announced plans for a comprehensive revamp of physical infrastructure, equipment, and the retraining of frontline health workers starting in 2024. Now, to further discuss this, joining us is Dr. Chukwudi Analo, the consultant primary care medicine from Sheffield, UK. Thank you so much, Dr. Analo, for joining us.
Thank you very much.
Now, Dr. Analo, a lot of people will think it's quite ludicrous for the president to appeal to the country's poaching Nigerian healthcare workers because, Nigerian healthcare workers on their own are looking for better pastures. So what do you think about the president's call for healthcare workers to come back home and for the countries poaching them to consider Nigeria?
Well, I must say it's quite laughable that we always come back to these jamborees by our leaders. You're appealing to people to come back, but I think I should first of all start by also appealing to the president and his cohorts to stop seeking medical attention abroad. So that way we can start from having a balance, but to focus on the real issues in terms of what it is that the president is talking about. You cannot beg your way to development. You need to bring out the right indices, the right economic push and pull factors that have driven these people to these countries to start bringing them back. So when you put the right things in place, the right policies, the right funding, the right leadership, and the right technology to back these services, then people will start. You don't beg them to come. The same way these countries who put them did not beg them to go there, but they put the right infrastructures in place, the right technology, and the right funding and policies. That will be what will drive it. So let us see the federal government stop talking more and start acting. Then we can start taking them serious, and you start seeing that a lot of people on their own will start going back. So I don't think it's a good thing for him to say he's begging. There's no time for that. Nobody's waiting for that jamboree. We want to see more actions, and let's talk.
Right. I like how you put it. You cannot beg your way to development. Now, talking about recruiting health workers from abroad, what do you envisage will be the challenges and the opportunities that come with it?
So I think there are a lot of factors. First and foremost, the basics needs to be there. You cannot bring a doctor who is vast experience, who has a passion to be able to save life to a system that doesn't work. You can't bring a doctor back to a system. For example, let's look at the budget to tell you that you need to see the seriousness from the leadership. In the government's house, at the state's house, the budget of over 6 billion to purchasing of motor vehicles. You see that the National Commission for Disease Control is getting about 4 billion. Tell me, how does that make any sense? These are the factors that people see, and people just call everything they say a bluff. You need to show seriousness. What is your policy? How do you want to design your health system? It's not coming out to read some very flattery documents and say, oh, we're going to invest. You've claimed to invest about 2.5 billion US dollars. Where's the paper to tell us where is this money expected to come? Where are we hoping that we will see this funded? But beyond that, one thing I've always said about healthcare in Nigeria, at the moment, the design structure is faulty, whereby whatever money you put in will always flow out because it's like a basket. Where are the policies to tighten the things, where we start seeing real investment? Where, for example, looking at the budget, a federal medical center is budgeting about 1 billion, and you see only 100 and something million of that budget is actually being used for medical and health services. The rest is put into frivolous expenditures. So how do you want to achieve results when you are using a lot of your resources in the wrong places? So let's start looking at more cost-effective spending, where we are prioritizing what we spend on, what will give us the maximum output that will help us cater for Nigerians and give them the best quality of health.
All right. And how do you think that this initiative would affect access to quality healthcare in Nigeria? Because, I mean, of course, we have to consider the people in itself. I mean, you know, the government has its own tactics, but Nigerians are the ones actually suffering. So how do you think this will affect access to quality healthcare?
Well, increased funding definitely will increase service availability. You'll be able to pay more people. You'll be able to, but at this point, we're struggling with the challenge whereby you're competing with other climes because you've not put the right infrastructures in place. So increased funding will increase. There's a huge decision to chase the fact that they want to increase the primary healthcare centers from about 8,000 functional at the moment to about 17,000. So if you bring more of those facilities on board, but then we now need to talk about factors that facilitate people accessing these facilities. Do people have this wherewithal to want to access these facilities? Do they have the trust in these facilities? We need to see the government put in the work. The federal government, for example, you cannot be telling people that, oh, we are putting money in these facilities and these facilities work, but you are not accessing these facilities. You need to be the first promoter of these facilities and encourage people that, oh, I went there and I got my medical care and I feel better and I'm able to patronize more Nigerian services. You need to give people the confidence. That way, more people will see reasons to patronize these facilities. And most importantly, we need to talk about the right policies to drive usage and ensure that people do not go into poverty by accessing healthcare.
Right. Now, what measures do you think are necessary to ensure that going forward, you know, we do not have this issue of brain drain again? Because we have really overflogged the issue. And like you said, you know, it's high time we stopped coming all the way back to this jamboree. So how do we ensure as a country, as a government, that we do not keep losing our health workers, you know, to outsiders and then having to beg them to consider the country?
So in terms of the healthcare, what we've seen over the years, we've seen something that keeps happening over decades. And what happens is because the way healthcare runs, you tend to notice that when you ignore investment in healthcare, it takes about 5 to 10 years for you to start seeing the full effect of that. So we need to see a consistent investment in healthcare, a consistent level of seriousness, a consistent level of commitment from the leadership. And the leadership needs to come to that point where they are very transparent with their proposals. We want to know, what is the government's plan in the next 10 years? Are there documents, and are we seeing that the government is following through? That way, people will have hope in the system. Because what makes people leave is when they don't see hope. When people graduate from medical school and they cannot tell you where they will be in the next 5 years, that gives them a lot of hopelessness, and that's why they're leaving. But if you can create a full functional system where at graduation, I can tell my pathway for the next 5 years. I can tell that when I finish my postgraduate training, this is what is going to lead me to my next point of development. I can tell that this is what will happen with my medical training. This is what is going to happen with equipment of hospitals. This is what's going to happen with funding. When we see that level of transparency, when people see that level of drive and commitment, I think that will start giving people more of the confidence to stay back. But if you sit down and find out that every month you're going on strike, people are being owed salaries for 8 months and nobody's talking about it, and they go on strike and then you threaten them with sack letters and all of that, people will go to greener pastures where other people value them. So this is something that we need to see critical commitment from the government at all levels, from the local government, the state government, and to the federal government. We also need to see proper policies that are well thought out, not policies that are made to just see like, oh, I'm working. We want to see policies that help through the fire, will stand the test of time. Thank you.
All right, Dr. Chukwudi Analo, consultant primary care medicine from Sheffield, UK. Thank you so much for joining us and sharing your thoughts on this. And we do hope that things get better in the health sector so we don't have to beg other countries to consider our own country. Thank you once again for joining us.
Thank you very much. And I hope that we'll come back soon.